The effectiveness of treatments for autoimmune neuropathies, such as chronic inflammatory demyelinating polyneuropathy or CIDP, depends on their ability to reduce the number of antibodies responsible for the disease. The treatment involves two strategies. It attempts to reduce inflammation while limiting the body's immune response. Inflammation can be reduced by taking corticosteroids. This medication reduces inflammation and requires precautions which must be discussed with the prescribing doctor. Immune response can be modulated using specific treatments. The first possible treatment to reduce immune response is the injection of versatile immunoglobulins found in blood plasma. These immunoglobulins or plasma-derived therapies are obtained through blood or plasma donation. These can be administered intravenously. The versatile immunoglobulins then block the pathogen immunoglobulins that are attacking the peripheral nervous system. Although the treatment allows many patients to regain and maintain physical autonomy, it must be carefully monitored by the doctor, who will carry out a risk-benefit analysis when prescribing the treatment. These immunoglobulins can also be administered by the patient themselves via subcutaneous injection. A battery-operated pump administers the medication while allowing patients to enjoy significant freedom of movement. Plasma exchange is used to reduce the number of antibodies causing the disease. The treatment consists in passing the patient's blood through a machine that extracts the pathogen antibodies. Blood is fed through the machine into a centrifuge that separates plasma from the blood. Plasma is the fluid of the blood that contains various elements, including antibodies or immunoglobulins. The plasma is then passed through another filter, which extracts the patient's antibodies. Once filtered, the plasma joins the blood from the centrifuge, and the mix of blood and filtered plasma is re-injected into the patient. The process of plasma exchange requires patients to go to the hospital and requires specialized equipment and trained staff. As a last resort, and if all other treatments are ineffective, immunosuppressors can be prescribed. Often designed to destroy antibodies without discrimination, immunosuppressors are, in the case of autoimmune neuropathies, prescribed at doses that can modulate the immune response rather than totally eradicate it. Neuropathic pain is a common symptom of autoimmune peripheral neuropathies. Due to its complex nature, it must be carefully monitored by medical professionals so that patients are able to live more normally with the condition. There are several types of medication for this. These treatments must be monitored carefully and regularly. However, there are also non-pharmaceutical treatments such as hypnosis, relaxation, psychological support, certain manual therapies, or even neurostimulation that may help the patient to better manage their pain.